Well, this morning I know a lot of you out there are having questions currently about this virus and what to do if possibly you feel sick.
Dr. Tanya Altmann joining us here. She's the founder of Calabasas Pediatrics and a member of several local coronavirus task forces. You've been on this since the very beginning. Yes. We got a question from Leroy here on Facebook. I've actually heard it from many people too. What's going to happen with the homeless population? We see hundreds of thousands out in the street, compromised immune systems, and not very great access to soap and water for some of them.
You're absolutely right. I mean, this unfortunately could be a potentially huge problem like we saw a few years ago with hepatitis A, because they don't have the ability to hand wash and disinfect, and many of them do have underlying health conditions. It can spread very quickly through that population. We also don't currently have adequate testing, and the more and more cases we have, the less we'll be able to, take care and treat them in our local public health care system. So it is something that we all need to, try to help and be aware of.
Amanda Martinez has a question that I think a lot of people are asking this morning. What if you're pregnant and you think you might have coronavirus? Currently, she is 21 weeks and have yet to hear about pregnant women and how they might be affected by this.
So, that's a great question. When we look at the China data, we do have a small number of pregnant women who contracted the virus and did give birth to healthy babies that actually tested negative. So she should always talk to her own OB-GYN. They're probably going to recommend she gets tested, she stays home, and she really takes care of herself, because pregnant women are in general more at risk for other illnesses, such as the flu. But I think in general we're seeing good outcomes. The question then becomes, like, if you give birth to a baby and you maybe have coronavirus, can you breastfeed? And so that's also something we're discussing and studying more in the community. I usually recommend washing hands, wearing a mask, and still giving your baby breast milk, because I think that's the best way to pass on antibodies. But talk to your own doctor and get your personalized advice.
Doctor, quickly, you've been on the task force. When are those tests coming? Have you heard anything about that?
So we hope to be getting more and more tests available every day. Ideally, what we need is public health screening here. We need the closed public schools set up in their parking lot where you can drive through, like Kaiser in Northern California is doing and Colorado is doing, and get tested, because we won't really know what we're dealing with and the exact numbers until we have widespread testing. So that's what I'm hoping becomes more available, in the next few days and weeks. And I really think we will see it. It's just going to take a little bit more time.
Last question for you. We did have a child who tested positive today in LA. What does that mean?
So the good news is that kids are actually relatively minorly affected. Most kids that get the coronavirus only have mild symptoms, and they will get better. Even if you look at the China data, the few kids that were hospitalized, they all ended up fine afterwards. So I think the hospital is taking care of that child and their family and doing contact tracing to see if they could have exposed anybody else.
Quick question from Sergi from Facebook as well. I've been having a sore throat, no fever, no runny nose. Is that a symptom of coronavirus?
It might be. I mean, you can have mild symptoms to more severe. But again, you should talk to your own doctor. Stay home if possible, unless you feel sick enough to go to the emergency room where you need treatment. Fever and dry cough are some of the main symptoms that people are using to decide whether or not to treat, in addition to if you've been exposed to anyone. But unfortunately, we don't know, because it is now probably widespread in our community.
Quickly, you said something. There's no cases in San Bernardino County or Ventura County. That's because no one's been tested.
Exactly. And as we test more, we will see better numbers, but that will also give us a better idea of what we're dealing with. And then we'll be able to know if we're truly flattening the curve by having everybody stay home.
So many great advice there and information. Thanks so much, Doctor. Really appreciate your time.